It's hard to think that something of that extent could be ignored, but it does.
During this presentation on alarm fatigue and patient safety, we will discuss what alarm fatigue is and how it pertains and its importance to nursing practice, as well as the JCAHO safety goal related to alarm fatigue. The objectives for this presentation are: by the end of this presentation, the learner will be able to describe the definition of alarm fatigue. By the end of this presentation, the learner will understand the JCAHO patient safety goal related to alarm fatigue. The learner will be able to state why alarm fatigue is important in nursing practice by the end of this presentation, and the learner will be able to actively engage in discussion with peers regarding alarm fatigue and patient safety by the end of this presentation. What is alarm fatigue? Nurses are exposed to a cacophony of beeps, buzzers, and other tones that lead to a desensitization to alarm response. False or nuisance alarms are created when alarm thresholds are set too high or are triggered inappropriately. The number of alarm devices continues to increase from an average of 6 in 1983 to over 40 in 2012. Alarm fatigue occurs when staff members are overexposed to these noises and alarms, causing sensory overload leading to a decrease or avoidance of alarm response. This desensitization can lead to life-threatening patient events. The Emergency Care Research Institute, a nonprofit organization that researches approaches for improving patient safety, identified alarm fatigue as the most significant of the top 10 health technology hazards for 2014. In 2013, the Joint Commission published a Sentinel event report and proposed a national patient safety goal focusing on medical device alarm safety. This national patient safety goal 611 is make improvements to ensure that alarms on medical equipment are heard and responded to on time. This national patient safety goal contains two phases. The first phase was to be completed by July of 2014. That phase required all accredited hospitals to establish alarms as an organizational priority and to identify the most important alarms through a comprehensive risk assessment. Phase 2 is to be completed and implemented by January 2016. This phase compels accredited hospitals to implement policies and procedures containing specific elements related to alarm safety, such as who can set, change, or discontinue alarms and monitoring. Now that we know a little bit about alarm fatigue and the patient safety goals, let's discuss why alarm fatigue and alarm safety is so important to nursing practice. As mentioned earlier, the Joint Commission issued a Sentinel event report on alarm-related events. This report cited 98 clinical alarm-related events reported between 2009 and 2012. Within these events, 80 patients died, 13 patients experienced permanent loss of function, and 5 of the events led to unexpected health care and extended hospital stays. Major factors identified as a result of alarm fatigue leading to these events included inappropriate alarm settings, alarms turned off, malfunctioning alarm systems, and audibility of alarms not sufficient to be heard throughout the patient care unit. Almost all of these factors could have been prevented by the staff alone. Some minor interventions that are recommended to be done to decrease alarm fatigue includes assessing alarm parameters every shift and adjusting accordingly, raising alarm volumes to be heard throughout the patient care area, properly applying and changing electrodes as needed, and having a clearly stated criteria for discontinuing or reducing monitors and alarms. While there are still many other interventions that can be implemented, these few are a great start in eliminating alarm fatigue and increasing patient safety. I hope you now have a better understanding of what alarm fatigue is and why it is so important to patient safety. Please take a few minutes to read over and respond to these discussion questions regarding alarm fatigue and patient safety. I'm looking forward to hearing your responses.